All right, welcome everyone to a new episode of the Roscoe's Wetsuit podcast. I'm with a special guest today. We've got Jordana Adler on the show. Jordana is the Lead Neurofeedback Technician at Santa Cruz Neurofeedback. She has graduated from the Pacifica Graduate Institute with a master's degree in depth psychology, emphasizing in somatics. She's also a certified professional coach, yoga instructor, and leads the center's 2 weekly restorative yoga classes. She spends most of her time continuing her studies of neuroscience, which is her personal passion, along with, I just found out, snowboarding. So, Jordana, welcome to the show.
Thanks. Thanks for having me.
Absolutely. So I wanted to just get started with kind of asking you, what originally got you, what piqued your interest in neurofeedback? How did you hear about it and what drew you to it?
Yeah, it's an interesting, I took a funny route. I was just walking down, it's called SoCal. It's like in Santa Cruz. Santa Cruz has all these little pockets. I was walking downtown one day and there was this place called the Center for Transformational Neurophysiology. And I was like, I don't know what that is, but that sounds cool. That sounds like something I'm interested in. So I remember trying to knock on the door and it was locked and I was just like, okay. So I found them online and then I think I emailed the director and was like, hey, I don't really know what y'all do, but I think I really want to be involved somehow. So long story short, they let me volunteer here for about a month, 2 months, something like that. I think I got a brain map done and then let me volunteer to pay it off. And then they hired me. And I was like, I've just finished grad school. And I was like, yeah, sure, why not? And it just seemed like the more I studied the actual field of neurofeedback, there were a lot of parallels to theories I had kind of come up with and guessed about that was going on in the brain during particularly things like flow. I did one of my fieldwork studies in grad school on flow. So there was this SMR rhythm they call on neurofeedback, sensory motor rhythm. And I was like, I guessed that flow is very linked to high alpha, low beta. And I was kind of like, hey, there's this thing in neurofeedback. I was just like, it all just kind of clicked together. So, and then of course I was like, what am I going to do daily for a job? And I was like, I definitely want to be around brains. So, yeah, that's kind of how I got involved in it.
Very cool. Very cool. So kind of learning all the stuff from grad school, but then actually finding a way that it's actually being applied, right? As far as
Yeah.
the neuroscience end.
And I was kind of amazed that I hadn't heard of neurofeedback until then. I'm still kind of amazed that someone who studied psychology, got a BA in psychology, and I also, just studied psychology, studied neuroscience, went to grad school for these types of things. No one ever mentioned neurofeedback. So I'm still kind of amazed at that.
Right. And I mean, I have some theories as far as why, that may be the case, as far as why there isn't a greater kind of public recognition of it. But I mean, I'd be curious to hear your take, because it's something that, I mean, I kind of found the same thing with school. I mean, I learned, EEG in my research lab, but other than that, it's like all of this stuff I found out about outside of school. And, it seems like something that, where you can actually apply it to real, all of this science to real people and benefit real people. It seems like this should be, at the forefront of what they're teaching.
My guess, to be honest with you, is I think it's just too new. You know what I'm saying? I think it's just, we're just if it was 10 years down the road, and I was 10 years younger and I was, what I'm saying? I just think it's just too new. And it just takes a long time for people to find out about things. It takes a long time for really science to have the validation type stuff, especially in a clinical setting. And then also, why does neurofeedback for a certain percentage of the population doesn't seem to help as much as for others? And just seems that some people it's not that they're resistant to it, but some people, it seems like super effective right away. And then some people, it seems like it just takes forever.
Right.
So I think that, when you talk about medications and you talk about that type of, normality that we have, particularly in our culture, we want to pay for something, we want to see instant results. That's what we want. That's what we're expecting. And I think neurofeedback, it depends on where your consciousness is. It depends on where your attention is. There's all these other things that kind of depend. I guess ILF is a little different, but yeah, so that's a whole nother discussion. But I think in general, I think it's just, It's not something that everyone could come to and you could pay a certain amount. I mean, again, even with the double-blind studies, it's hard to do that with neurofeedback. So I just
Right.
think that's probably what's hindered its expansion. But I mean, I've been here about 4 years. We've had this center about 14 years this year. And I would say the last 2 years, we've really like exponentially grown. So, and a lot of people are referencing Body Keeps a Score, a huge one. And therapists are referencing them to us. And I think that's what's, what I'm saying? Like, it's just taking a long time, but I think that's the concept. It's taking a while for people to kind of get it out there. People write about it, people learn about it, then they validate it. It just takes a while. But I do think it's kind of hit a little, it seems, at least where I'm at, it just kind of hit a little bit of a turning point. It seems like a
Right.
lot more people are coming. Yeah.
Right. Yeah, I wonder, I mean, it seems kind of like with the increased popularity of like yoga and meditation and those kind of, more Eastern practices where that's becoming more and more popular, it seems like, people are recognizing, the prescription drug, you know, I guess, over prescribing them, or just the opioid epidemic and all that stuff. And people are looking for more natural means to both, kind of correct brain problems, along with, I think there's, the new interest in peak performance, not just how can I fix my brain, but how can I actually get the most out of my brain.
Right. And my experience, particularly in this field, is I feel like it's that's why I always say there's such potential in this field, because there's so many different avenues, and so many different reasons someone could come to neurofeedback. I think most people come to us more for the therapeutic reasoning. I'd love to see more peak performers, but it's expensive, and it's expensive to spend that much for a peak performance. It's different, if you're spending it because you're trying to feel better.
Right. Sure.
But that's part of it. But yeah, there's a very wide range of uses for this technology.
Right. And so just to back up a little bit, I mean, if you're a longtime listener of the show, definitely heard me talk about neurofeedback before, but for people who are just listening, neurofeedback is basically where you're training the electrical rhythms of your brain. And I wanted to ask, as far as, what's your take as far as, does neurofeedback work, more on a conscious level? Are people kind of consciously making these changes, or does it have more to do with subconscious or unconscious kind of reprogramming? What's, because I know you studied depth psychology,
Mhm.
which, from my brief understanding of, you're kind of exploring those different realms. So I'm curious, with your educational path, along with your experience with neurofeedback, what's your take on how it is working?
Yeah, good question. Um, I mean, the long and short answer is both. Okay, so my experience is, I think working with people day in and day out, I think that there's almost like two camps of people. You have like people that kind of really have the metacognitive piece, and they're aware of kind of their own thoughts. They're aware of this whole consciousness thing that's happening. And they can kind of play around with different thoughts, and they can see how the bars change in response to their thought. They have that whole awareness piece. And I think that neurofeedback offers those types of people a whole cool way to help them direct their attention and recognize different things that I place my attention on actually change my brainwave frequencies in real time. I think that is massively valuable. Even just that piece itself is hugely valuable. But then there's a whole nother camp of people, adults and children. Particularly children are interesting, because obviously they're not aware of these certain things, right? They're not going to have metacognition really at that age. So what's amazing is they can just watch the screen get brighter and know they want to make it brighter, and that's it. And that's all they need. And it's like massively effective. So that's obviously unconscious, right? So, I mean, at least from what I can understand, what my boss says and what I've seen with people and what I've read is, what I always tell people, at the very least, it's operant conditioning. At the very least, you want to, make the screen get brighter. You just want to, I often describe it like Marco Polo. Like, it's almost like your consciousness is just doing its thing, and someone's like, Polo, over here. It's like, I don't know what I did, but the brain loves patterns, right? That's what it likes to do. It likes to find patterns in the environment and guess the future. So we're kind of just giving it that fuel for it to figure those things out. And again, I mean, I could go into more depth about standard neurofeedback versus the network neurofeedback that we do here too. I think that's also a little different, but because I think the standard neurofeedback, I think it's easier to have the cognitive piece. I think with the network neurofeedback, like NeuroGuide, like Loretta NeuroGuide, I think it's almost, I wouldn't expect anyone to really have that awareness. But again, you know, more peak performers, people that are already kind of have that metacognitive piece. And because that's how I experience neurofeedback. Like, I'm very aware of my thoughts. I'm very aware of different spaces in the environment that I'm paying attention to and how that's affecting my my neurofeedback. So, but I don't always really know how to teach that to people.
Right.
So that's it's always a problem solving thing when someone comes in and they're like, "What am I doing? What do I do?" And it's always, each person is so individual. So I kind of give them all the pieces, but I notice some people it's overwhelming to give them the cognitive piece. So I just kind of give them the subconscious, because I think it's going to work on both. If you have the cognitive piece, you're going to have the subconscious piece. If you don't have the awareness piece of it, I still think it's going to work on the subconscious level. So does that answer that question?
Yeah, absolutely. One of the things that just came into my mind as you were talking, as far as kids being able to kind of, experience really good results with neurofeedback without having that kind of conscious component. I almost wonder, I mean, I was just thinking as far as, maybe certain adults who aren't benefiting from neurofeedback, whether there's almost the conscious component that interferes, as
Yes.
far as a lot of like self-sabotage and people, sort of wanting one thing, but their subconscious or unconscious belief system kind of getting in the way of what they're trying to consciously achieve. I just wonder if that's at all related, to people's progress in neurofeedback.
Yeah. Yes. I think what comes up for me and what I notice with people sometimes is they want it, like I said, like that medication. They want these really massive shifts. And neurofeedback is very subtle, and it's going to be subtle things over time. I mean, more often than not, we get people's spouses that say something, "Oh, I'm noticing all these changes." And the person's like, "I don't notice anything." Or they'll come in, I'm like, "Oh, has anything changed?" "Nope, nothing. Everything's the same." And then like a minute later, like, "Well, I am less reactive, and I guess I am sleeping better." Like if I ask them these other questions, they're getting better, but they're so used to this, like maybe such a quick shift, that they're not so great at tracking over time, which is what I feel like part of my job is, just to track over time and then be like, "Well, look at this. Like a month ago, this is where you were, and now this is where you are," And so I feel like that's part of that piece. And then of course you have the whole discussion about like the recreation of the self kind of thing, even in psychology, when you go through like psychological developments, like there's kind of this like pieces about the sense of self, right? If I've defined my sense of self in a certain way and now I'm kind of healing from that, you have to kind of recreate your sense of self and sense of identity. And there's that whole resistance piece to parts of that. And there could be a grieving piece. There's all these emotional pieces that I feel like one has to digest and move through usually to really feel quote unquote healed. I mean, that's really the best
Right.
word. So.
Yeah, that brings up a good point. I remember, when we were talking last week, as far as, if you say change someone's, electrical rhythms of their brain and you kind of correct those abnormalities, but if you're not still addressing kind of the traditional psychological component, maybe some people having issues sort of processing the changes that are occurring. I'm curious, just from your experience, what are common things that pop up, when people are kind of moving through neurofeedback, like obstacles or memories, or what kind of stuff?
That's a good question. More often than not, particularly people that come with anxiety, depression, balance going on, a lot of anger will start coming up. A lot of emotions will start coming up. So people will start crying a lot, or I've had people that are like, will start having something that normally took them like a whole week to move through. They just had depression for a whole week. Now they're having this whole experience in like 20 minutes. Like they're feeling like, like anxious and then depressed and then angry. And then they get sad and they cry. and then they feel like, oh, now I'm done. Like that was a whole little cycle. My understanding, a lot of ideas around that, but I think a lot of that is just processing. It's whether it's specific memories or not. I think it's grief over certain things. I think it's just digestion of emotions. I think it's just people, there's things that they're resisting, and when they come to us, I feel like it's helping them move through that digest. I always use this digestion metaphor for that psychological digestion, and I feel like that we're helping people kind of through that process. Very often I see that. Does that answer the question?
Yeah, absolutely. I mean, that's a good metaphor. I hadn't heard that before, but it actually kind of makes sense as far as if food needs time to move through your body, it would make sense
Yeah.
that your brain is going to take time to kind of deal with, moving through some of that stuff.
I feel
Um,
like I love when people start crying, and I love to be able to support them in the normality of that. Because to me, that's the movement. It's if you've ever been through deep grief before, if you would understand, you get this, you get the fact that it takes a long time, and it's like different levels, and you just have to like let the energy and the emotion, we'll say the emotion, you have to let it move through you. You'd mentioned the yoga piece. I feel like that's kind of what, in a lot of ways, there's a lot of things I think the restorative yoga offers. But for me, my experience and my journey, I feel like yoga has really offered me kind of this ability to kind of experience emotions in a more metacognitive way, and to kind of just let them move through me, instead of, why am I feeling this way? And then it's like, I go through this whole thing, or if I'm crying, I'm upset. No, it's just, okay, I'm just, whatever it's from, I'm just letting it move through me. And then it passes, rather than this like resistance piece and this, oh, I can't go there. It's like I do my best to try to just let it flow through.
right, right. I've heard it sort of described as sort of like, whether you identify, like your problems and everything, if you're in the midst of it versus if you're kind of at a distance, kind of playing the observer. Is
Yes.
that kind of what you're talking about there? Kind of being able to take a step back and sort of get an overview of what you're feeling instead of just reacting.
Yeah, in yoga, you often kind of say, it's not, you're going beyond the good and bad. It's not, oh, this is a good feeling, oh, this is a bad feeling. It's, oh, this is a sensation. And you're objectifying it in that way, so that you have more of that metacognitive awareness, and you're like, oh, it's a sensation. How do I make the sensation maybe not as intense? It gets rid of the psychological, like, dual connotations to things, because, and this is a depth psychological kind of piece to that I feel like I can say, but it's kind of like when you put light on something, you say something's good. Inherently, like when you put light on something, a shadow's created, right? So it's very similar in the psyche. It's like when you say something, this is good, that inherently means something else is now bad, right? Or the opposite. So instead of creating that dualism, you're trying not to create that, and just saying, oh, this is a sensation, and seeing things as they are, rather than through that colored lens of, it's funny, colored lens of black and white.
Hmm.
A dual blends of black, and actually, because the colored lens would actually be more accurate in terms of, it's just a sensation, and one could look at it good, bad, rough, tight, I don't know, stressful, whatever. I'm just making things up, but it could technically be all of those, right? So playing around with consciousness in that way, and playing around with your attention. And what's amazing in yoga, one of the reasons I love it, is you can start playing with your attention, and then you start almost trying on different ways of seeing or different ways of feeling a sensation. And in yoga, it's so noticeable when one of them, like you try on one and you can like balance, and you try on another one and you can't, you're doing the same thing. So yeah.
Interesting. So I wonder, we're talking about sort of this greater sense of awareness or just metacognition, we're talking about with neurofeedback. I'm curious, from a neuroscience perspective, do we know, what is going on chemically and electrically in the brain when people are getting this, when either they're cultivating this sort of metacognition with yoga or neurofeedback, or some other sort of practice?
Uh, Theoretically, I'm sure there's something out there that gives, guesses, educated guesses about what they think is happening. I'm sure. And I'm pretty sure I've read a couple of those things in grad school about, like, I think I've read multiple things about how it supports your immune system and things like that. I'll say just what I can actually speak about accurately is, I know in grad school, again, with that flow thing I was telling you about, one of the things that I got really into was this embodiment concept, which is basically just taking your attention and putting it on your body, essentially. And I felt like doing all these different embodiment practices, it almost, to me, it was like I'm myelinating those connections eventually up to my consciousness, right? Like the more attention I place on different parts of my body, eventually I'm going to start feeling it. I'm going to start feeling it. And that's, I mean, if you ever have those things, some issues or something like that, it's physical therapy, right? To get feeling back in your hands, to get that movement back, that neuroplasticity, that remyelinating, or maybe just myelinating in general, those connections. So my theory I put in my grad paper, what was that, like, I don't know how long ago that was. That was 2016. So 4 years ago. Maybe it was the year before, 2015. Either way, 2015. The idea was that I feel like my theory was that the more attention you place on the body, the more myelinated those connections become, and eventually it becomes conscious awareness. And so then, like with yoga things, then you're actually more aware of these feelings and these sensations inside of your body. And then that's, of course, a whole journey. And there's, again, I could talk about the shadow side of that too, if I really wanted to. But
Right.
now that I'm feeling, because most people are disconnected from their bodies, right? Because it was uncomfortable at some point, and then you shut off from it. But
Yeah.
there is a, yeah.
No, sorry to cut you off there.
No, go ahead.
No, I would just wanted to kind of jump into that. You brought up as far as people being kind of disconnected from their bodies. I'm curious. I wanted to ask you as far as like how you think with yoga, how that kind of bodily awareness. How does we talk about physical ailments, and mental health ailments. Like there seems to be definitely a relation. Does yoga sort of kind of help you identify those, or I'm just curious that what's the connection
Yeah.
there?
So I'm going to speak for myself here in my own journey, because this is different than restorative yoga. Like what I, as a teacher in restorative yoga, am intending to do is different than what I'm experienced necessarily in my own yoga practice. So for the question that you asked, I feel like when I do yoga, I'm like as metacognitive as I possibly can be. And then I'm just noticing different postures, different memories that are arising, different like things that are theoretically stored inside of my body. And noticing like, this kind of hurts right here. Okay. Is there any like mental imagery that's coming up? It's just kind of like playing with all those different things. I could have theories about maybe people say things are stored in different body parts and all of that. And that's my experience in a lot of ways, especially when there's pain in certain parts of my body, like my knee is hurting. Okay, it's the right knee, it's this side, and I just kind of start feeling into it and seeing if any memories come up or anything. To me, that helps with my self-healing, but I can't say that's going to work for everyone, so I don't necessarily know that's something that everyone would experience or is valuable for everybody. But I know for me in my journey, it's been really helpful. It's a massively psychological thing for me. Yoga is. It's very physical, obviously, but it's more psychological than physical for me.
Mm-hmm. Right. I've personally noticed just going to certain, yoga classes, like there'll be some teachers, um, I don't know, who will lead it in a way that it seems like there's more kind of attention paid to, either the stretching, just more of the physical component versus, more really following the breath and really being aware of all these like emotions and thoughts that come up.
Yeah.
I'll notice myself, I don't know if you ever have this, but like I'll feel much different like after a class, like depending on kind of how it's the style in which it's led.
Yes. Very. And the latter is my favorite. Yes.
Yeah.
Exactly. Yes. And even like in my classes that I teach, I like to often especially if people are leaning forward or doing forward fold type stuff, I have them breathe into the back of their body. So their inhale is in the back and then they exhale out through the front. So you're kind of like, if that makes sense, like you're kind of directing your attention and trying to direct your breath in a certain way. And if you do that, especially if you're leaning forward and you breathe into your back, you'll notice that you can really feel your back kind of like, you can feel it. You can feel it. It feels different. We'll just say that. It feels different. And then after they've done that for gosh knows how long, 15 minutes altogether, maybe 20 minutes altogether, different poses, then we go onto our backs. And now you're inhaling through the front and exhaling through the back. And now your back is on the ground instead of your front, and just feeling those differences and noticing mentally how different that feels. I mean, people, it seems in some ways simple, but your posture, that type of stuff is going to affect your psyche. It's going to influence it. Let's put it that way. I'm not going to say it's going to control it or anything, but it's going to affect it. It's going to have some influence. And I think that type of connection, I guess, to me is just really fascinating. And I feel like that's in some ways a self-healing, right? We're letting the body kind of have its own digestion process and have its own self-healing process. And I say that self-healing in terms of like realignment and just feeling good, essentially. Yeah.
Right. So yeah, I guess there's different ways you could sort of explain the benefits, one might experience through yoga. I've seen, I think, a couple studies like with, I believe it was like increased levels of GABA, that they found after a yoga session and decreased levels of cortisol. Curious, like, are there any other studies that you've seen, or do you get into this stuff at all or are you more so just?
Not anymore. That's what I'm saying. Like I could go back to my grad school like stuff, and I'm sure there's that one article I'm thinking of that I remember reading about different meditations. I think it was Tonglen and maybe a couple other meditations, loving kindness meditation linked to like immune system support and stuff like that. But I'll be honest with you, I can't even think of anything right now because I'm at a place really, I feel like that I don't really need I feel like I've read so many things and I'm just so, I guess, convinced, I guess, that it's so supportive to just take time to focus on your breath, like take all of your attention, focus it inside. And just, it's so nourishing to do that. That I guess for some reason I don't feel like I guess it's not that I don't care about that other piece. Because I'm sure I think it's valuable to know it, but it's just my experience is so validating that I don't, that lack of a better phrase, I don't care.
Right. That brings up a really, like, I don't know, I forgot where I had seen this, but I was like reading an article, like, as far as talking about, when you're coming at something from a strictly like scientific perspective, we could say, socializing will increase, serotonin and oxytocin and decrease whatever, you could explain it as far as all that, but people don't go out at night because they have in their minds, oh, I want to go increase my levels of serotonin. They're like, I want to go have a good time. And then in turn, those chemical changes take place, but it's not like you need to like know that part in order for that to happen.
And then I'm thinking
that changed my perspective on things a little bit.
Right. And then the question is how would that be helpful to know that? Like if you did know that, and in some ways I could see myself feeling like, okay, oxytocin, like I could see why, okay, that's where that feeling's coming from. Okay, got it. That's just that. And then I guess in some ways it's objectifying it because then it's in could be a good way where it's like, okay, that's why I feel good in this scenario. How else can I get oxytocin? I could see that being valuable. But I don't, in the yoga perspective, I don't find it important. I'm kind of more on the camp of if it's something you feel like you want to do, great. But I still feel like everyone's going to find their own thing. Yoga is just one avenue. I just happened to, stumble upon it years ago. And for me, talk about snowboarding, you mentioned slightly. Snowboarding was like my first introduction to flow. I think it was just, I loved it. loved it. And I was like, I don't know what I'm doing here, but it is like, and it really ended up being, I think, embodiment and directing my attention. It was amazing to me how based on where I directed my attention is where the board goes, and how well I can actually snowboard down something really depended on where my attention was and how focused I was, to a T. I mean, to the point where you'd fall instantaneously. Like, I used to have a Bluetooth headset in my helmet, and like somebody would call me and I'd answer, and I would fall every single time instantaneously as soon as I said hi. And that type of connection fascinated me. And I think yoga, like I said, is a great way to play with that too. But it doesn't, and now I found yoga because I couldn't snowboard anymore. My life story took me somewhere else, and then I couldn't snowboard, but yoga was giving me something similar. And I was like, I don't know what it's doing, but it's helping me get up in the morning. And I always feel better when I'm done. And it's similar to the feeling I get when I snowboard. So I want to do that.
Right.
That's
Being a snowboarder myself, I feel like look at me. I mean, that was probably my first introduction to flow is, either mountain biking or snowboarding, where you're just
Mhm.
flying down a mountain and, you don't have time to think about what am I going to have for lunch or what do I
Mhm.
need to do for work. I had read about, I'm sure you may be familiar with the Rise of Superman, the book
Mhm.
on flow
Yeah.
by, yeah, Stephen Kotler,
Yep.
um, where he's basically talking, or he's basically, studying these extreme sports athletes, and looking at how, basically they're pretty much forced to get into flow, like these flow states, because they could die. I mean, if they momentarily have this lapse of, consciousness, if they're surfing on a big wave or something, that, I mean, they could literally die. So it sort of just takes you right there. Was sort of my understanding of it.
Yep. Yes. And imagine if you could just harness that and use it whenever you want to. You know what I'm saying? Like, no,
Right.
I'm not about to die, but I could still harness that same mental space. And to me, that's in some ways peak performance. I mean, all of these things are all about playing around with attention, in my opinion. It's all about direction of attention. I feel like it's like, if I could have like one slogan, it'd be like direction of attention. Like, that to me is the key. And yeah. And that's why, yeah, again, why I love yoga, because it shows me instantaneously, it gives me instant feedback when I'm not directing my attention where I need to. If I'm doing a balancing pose, I fall right away. And that's fine. In yoga, you really try not to judge yourself. Okay,
Hmm.
fine. That was silly. All right. Well, I'll try again next time. That's fine. But it's instant feedback. And to me, neurofeedback is too, right? It's instant feedback. And you need that in flow. Stephen Kotler's whole flow fundamentals, if you ever go down that path, you need instant feedback. That's why snowboarding, that's why a lot of these mountain biking is so flow orienting, because you also get the instant feedback. There's a lot of things to it. There's like a whole list, autotelic, things like that. But yeah.
So I'm curious, maybe being introduced to flow, with like snowboarding or yoga, do you find yourself able to sort of get into that sort of state, if you need to, say, get a big project done at work, or, if you want to, you know, get yourself into that flow state, do you feel like those experiences kind of have trained your attention in order to do that?
Yes. Not 100% of the time, not every day am I going to be able, some days are just not as good as others. But I would say about 90% of the time. Yeah. I feel like I have really good influence. Hate that word control, but in some ways a little bit of that. I feel like I really can get into that state. Yes. I know what it is for me. Particularly when I do yoga. The hardest part is my day to day now is that I often get interrupted with, other people asking me questions. But even then, it's like, I feel like I can still kind of stay there and I can get back there much quicker and much easier. Um, Probably than maybe some others who aren't super aware of what's happening in their attention or within their consciousness. Yeah.
Right. That's definitely a super, super valuable skill to have.
Yeah. Especially
Yeah.
when you got to get a lot of stuff done.
Yeah,
Yeah.
absolutely. So
Yeah.
I want to switch gears a little bit. One of the things we talked about, before that I thought was really interesting, as far as, with the DSM and sort of putting these labels on people, with the
Mm.
mental health sort of stuff. If we're putting someone into a box, you have this disorder, requires this treatment, whereas, I think the way both of us sort of think about it is more of, more of kind of just the way someone's brain is functioning, and less of like a diagnostic. I don't know if there's a better way to phrase that, but
I know what you mean. Yeah.
Yeah.
It's I think DSM is the psychology's attempt at one, making something as medical as they can, because that's what you do in medicine, right? You do a test and then you find out, okay, this is what they have and this is the protocol. One of the main reasons they do it is because that makes it as insurance and as and I understand the intention of it. The intention of it is so a practitioner, they can teach anybody this, right? A practitioner can say, you just have to follow that. If they're diagnosed with this, then this is what we say will solve the problem. So I get why they come at it from that way, but it's not ontological truth, right? We're not getting at the actual reality of what's actually happening for them. We're just seeing the outside symptoms on the outside of it, and we're assuming, hey, this is kind of like that. So let's assume it'd be like the same thing as if you went to the doctors and you're like, oh, I have a runny nose and a cough, and they're like, okay, then you have this, so take this medicine. But it's not getting at the actual, what do you really have that maybe actually might be causing it. So it's the same thing as kind of that. It's funny, my brother's an emergency medicine doctor, so for him, like, he just wants to stop the thing right away. And for me, I'm like, well, if it's chronic, or if it's a chronic problem, then you're just putting Band-Aids on it.
Mm-hmm. It
But yeah.
almost makes me think of, just as far as like with, say you take something like obesity, that someone could go into the doctor and they could have, high blood pressure and high blood sugar and, high cholesterol, all these million things. And it could just all be related if this, person has a lot of excess weight, they could throw them all these different medications, but
Yeah,
sort of
what's
akin to what
causing it, right?
exactly what's causing it. So I think that, it seems to me that that's a better approach in general when it comes to these kind of chronic, like long-term sort of psychological issues that we're talking about.
Right. Yeah, exactly. I just don't think that I see the value of what the DSM is trying to do, and I see why they do it. But I just don't think it's going to solve the problems. How do I say this? It's not, it can cause more problems in some ways than one would expect. Like, in other words, like if someone quote unquote misdiagnosed, I feel like people often say that to me, oh, I was misdiagnosed. Like, a diagnosis can be so helpful for people, but at the same time, it can also really put them in kind of this little box, right? Oh, only these types of things are known to help that. And because they could spend many years going in one direction, that actually might not even be very, like, the direction they should go in, because that's not really what's happening for them. So that's what I'm saying. It's a difficult one for me, because I see the value of both, but at least from my point of view, and particularly working with the brain, right? You're not, they don't really have, they obviously have certain brain disorders, right? And you have those types of things. But what I would like to see in psychology is maybe using more like fMRI is going to be difficult, but using EEGs to help, quote unquote, if you're going to use the DSM to help diagnose that type of stuff, would be nice. To do some other types of tests to help understand, maybe what comes up for me is even like things like psychosis and stuff like that. Most people that have that type of issue, go through like 60, 80 medications until, it doesn't feel like psychology is trying really hard, but I just don't feel like we're using all the tools that we have to really actually help people. It's more, okay, we've got a lot of people coming in. How do we organize them, and how do we treat them in a way that's replicable, and a way that, if, like I said, protects the practitioner, so that it's the same path for everyone who's diagnosed with that. Does that make sense?
Mm-hmm.
Yeah.
I'm curious, as far as, do you think, I mean, is it harmful in some ways if someone comes in? I mean, because I've personally experienced just, with my work, if someone comes in and they, say, oh yeah, I'm depressed, I have bipolar 2, and they, it's not necessarily in my perspective that that's the problem is like the whatever diagnosis they have, but it's like their view on it is it's as if someone told them they had like cancer or something that's like
Right.
a part of them that they can't change, yet there are all these ways to that we know of to change the brain. So
And
is
now
that
in
something
some
you run
ways,
into?
yes, yes. And in some ways, there's there's two sides to that. In some ways, you're going back to what we talked about earlier with the definition of like self. I always have this, I have this. And then if you're working on it, it's like, because it's exactly that. Like, oh, do I still have this? Do I still have this? Right? It's like someone has given you that label and now you have this. And the other side of it is it also helps define the symptoms. I mean, I guess that's what it's doing, right? We're defining symptoms. Like in
Mm,
some ways, that's all it's doing. Like if someone were to come in and say, I have this, if I have bipolar 2, I would say, basically all it does to me is tells me, okay, this is about the symptoms that they're having. That's all it's really doing. And then kind of shows me they're probably taking some medications because that's usually the route that most of those people go.
mm-hmm.
Um, that's about as far as I technically really think about it. And I know for a fact that my boss doesn't, we have a whole thing about that, diagnoses are one thing, but that we don't diagnose. Like the way that we look at things is outside that little model. We look at things more holistically. And then my bosses are really, really into knowing people's early childhoods as well. It's one thing with the nature, and then the nurture and the experiences is really, really important. Yeah.
What about as far as, with head injuries and, mental health, as far as, people say they've never struggled with anxiety or depression before, and then they get in a snowboarding accident, and then suddenly they have all these things pop up, and now they're labeled, with all these different diagnoses and different medications are pushed on them when really, it's more of a sort of a neurological issue. Is
Right.
that is that head injuries? Is that a big thing that you guys see?
Yeah, we see a good amount of TBI. Um, not as many people come to us for that as I would think they would, which is interesting. I think I think the reasoning why is because people hit their heads and then they don't associate, because they don't lose consciousness, they don't associate that with the symptoms, especially if the symptoms don't come up right away. Because that's really what they are, right? They're symptoms of something that happened, a hit to the head. Um, yeah, I'm trying to think. We just don't see as many as I would think. But yeah, I really think that's probably the issue, because we still have people too will say like, oh, did you ever hit your head, or have any, and like they won't. We always say that on the intake, and I'm telling you, like 50% of the time people won't write anything, and then my boss will again ask them,
Mhm.
oh, okay, you didn't hit your head at all, you didn't have any. Well, okay, actually when I was 6 I did kind of do this, and then when I was 10 I also had this. And it's just like it's that same thing where people just don't think it was a big deal, because they didn't lose consciousness, or they didn't go into a coma, so they assume it wasn't a big deal. But yeah, you hit your head, it is a big deal. Like it's I mean, the best way to say it is it really is traumatic for the brain. It just is. There's no way around it. And some brains probably may not be as hurt as others, or it depends on how intense the hit was. But at least from what I can tell is that, those, for lack of a better phrase, low grade concussions, can come up and can, at the core, that's why I come back to that ontological truth, like at the core be like actually really what's surfacing those. But then again, someone could have had the tendency towards depression,
Mhm.
and some things are just, yeah, they're going through a lot of stuff. I got some people that are just going through a really hard time in their life, and they're going through stuff. And it's like, I hear that, and so we're here to help support them. Um, and normalizing that too. Yeah. But
Hmm.
yeah, you're right. I'm surprised I don't see as many people, but I do think that's mainly why. Or like
Right.
I said, people actually did hit their head and that actually might have been what caused it, but they didn't put two and two together until we asked
Right.
them the
Right.
question. Yeah.
And then it's always the thing, at least, in my work, it's like, well, we didn't have a baseline scan before they hit their head. So
Right,
how do we know that this is actually causing these sort
right.
of brain signatures? So,
Well, two things actually. When I've had some of my friends, I actually just have them. I'm like, I just want a before picture, just in case something happens to you. Let me get a before EEG from you. But I actually asked Tiff this question because I was like, is this a normal thing with TBI? We saw this the other day in someone else's TBI brain, and my boss said it's somewhat common where you see that like you almost ubiquitous SMR a frequency that's coming up. That's kind of almost a compensatory SMR that's happening almost everywhere in the brain. And my boss said, I mean, that's what he said. He was like, oh, that can be a signature of TBI. The brain is trying to naturally kind of balance or heal itself. That's the only thing that I'm so green on my QEEG type of stuff. Like I have way far to go, but it seems like that's my first, like, okay, maybe that, that type of signature means that something happened to the head and it's, the brain's just trying to balance it out.
right. And I
Yeah.
think another thing that I think a lot of people don't realize is that, they could have, the like structural changes, like what could be seen on an MRI, they could hit their head. And if it's, kind of a mild TBI, it's not really going to show much. But then if you do a functional test of the brain with something like an EEG, you can actually see oftentimes massive, problems. So, but people,
Mm-hmm.
I think oftentimes, they just see, oh, the MRI, that the structure of my brain is fine, therefore the function must be as well, when that really isn't always the case.
It's kind of interesting to me. It doesn't seem like and I may be wrong on this. You can let me know your feelings, but I feel like EEG just isn't as valued or isn't as used as like fMRI is like somehow up here and EEG is like down here, when to me they're both massively valuable and important. One is how the brain is actually functioning, talking to each other in real time, and then one is just actual structural. So I think that it shouldn't be like this, it should be like this.
Hmm.
And I think that adds to the myths and misinterpretations of uh, consciousness, of head injuries, concussions.
Hmm.
Yeah, because I mean, I remember at the Neurofield conference, I can't remember his name right now, but he was almost like a concussion expert. And I was like, man, I feel like I wish I knew more about that type of stuff, because I feel like that to me is going to get bigger in the future, particularly from NFL type stuff. I'm a big sports fan.
Right.
And, uh, it's silly to me to push it off and say, oh, these aren't happening. It's like, you just got to admit that hitting the head really is going to be impactful, and let's do what we can to support these people. Like, it's amazing to me that they don't just get EEGs from every NFL player at the beginning of the season. Like, that's
Hmm.
insane to me. Like, why not? It's
Oh,
so
I'm
easy
with you
to do.
100%.
It's so easy to do.
100. You
I
know what?
won't do
And
it.
I'll
No
take it
one do it quickly.
I'll take it a step further. I think, like, I don't understand why you don't just go into the doctor for a checkup once a year. They do blood tests, whatever. Why don't they just do an EEG then too? You do an
Yeah,
EEG
it's
each year
so
of your
easy.
life. Oh, now we see some kind of weird changes and you're having difficulty concentrating. Okay, let's address this. Like,
There's got to be something in the medical community that doesn't like EEG. There's got to be something. There's got to be. I mean, there's got to be a reason why, because even a good friend of mine at the Neurofield conference, I was staying with him. He's an emergency medicine doctor, and he's like, oh, EEGs. He knows how to tell if someone's comatose or not. That's what he like. Well, not comatose or not. He basically is able to tell if someone's brain dead or not. So whether they should pull the plug or not, that's like
interesting.
as much as he knows. Like when I told him what I was studying, and I was like, okay, so that's what doctors kind of know, at least him, right? But I just think that there's something there. That'd be a really cool question to ask maybe a doctor.
Right.
Yeah, medically trained doctor, okay, PhD, right? So medically trained doctor. What are their views on EEGs? You know,
Absolutely.
because I think they think about it for sleep, but that's it.
Right. Or like seizures, like,
Right. Seizures or sleep. Right.
there seems to be a big division as far as like the way, say, like a neurologist might utilize an EEG versus, someone in our field,
Oh,
or
yeah.
right. Like,
Right. That's true. There must be some type of like, I don't want to say resistance, but either a feeling of not enough scientific support around QEEGs. That's my guess, is that it hasn't been around long enough. We haven't had the technology long enough. It's just not there. I just think there's potential for it, I guess is what I'm saying. I think there's potential. I also think that honestly, it's not super expensive in comparison. And for some reason, people also value things that are very expensive, like fMRI machines,
mhm.
versus EEGs are so simple in that regard. Plus you've got a lot of artifact. I guess maybe that freaks people out. I don't know why. That would be a great question though. I mean, you're right, because they use them only for certain things. Why not for more? But it's got to be something about the lack of knowledge, lack of practitioners. And again, I think there must be something that happened at some point in time that put a connotation to EEGs where it somehow is a little bit not as valued as others. That's my guess. I might
Mhm.
be wrong. I'm probably wrong, but
No,
that's
I
my
mean
guess.
that makes a lot of sense to me. The other thing that pops up is just, the differences in training. It's like if you're just told, okay, this is a technology to, evaluate and detect seizures versus, this is a technology where we can see all of these different patterns that can correlate with all of these different symptoms. Like it's just
Yeah.
completely different,
It would be really great if,
paradigms.
because I feel like psychology in general, I mean, you kind of more just finished your undergrad, right? More
Yeah.
recently. Because I know back when I did it, I'm sure it's slightly different now, the field of psychology, just like what they actually teach us and stuff. But I feel like it would be really valuable for the psychology world to really adopt EEGs more and for them to marry together. Because I think that's really where EEGs can be more helpful, because it's more about combining the psychological, the subjective and the objective, which I don't think medicine particularly cares about the subjective very much. In fact, I think their goal is to take out the subjective as much as they can and
Mhm.
look at things as objective as possible. When, and they kind of, it's it's the separation between the head and the body. Um,
Mhm.
and I think that to not acknowledge that the psyche actually has an effect on the body and vice versa, I think is sad, really. So,
Right. I
yeah.
mean, it seems like maybe the medical community is completely going that direction, but it seems like just people, at least, people in America, like with, as we were talking about earlier, just like this huge, growth of yoga and meditation and, neurofeedback. Now you're saying the last couple of years, a lot of people have shown interest. It seems like people are definitely gravitating more towards that subjective, trying to get a better handle of their experience. So,
Right.
and that maybe is sort of a segue into, what I wanted to ask you as far as, where do you see do you see this becoming a really big business in the future as far as people using neurofeedback, using QEEG brain mapping, um,
I do.
in a business sense?
Yes, I do. I do. Um, I think I say it all the time, but it's so true. The potential is massive. The potential is just so big because it's just extra data. I mean, as a therapist to have the extra data to know what's going on, even as a human, when you look at a brain map to know, oh, because everyone's in their own head, right? And I don't know what your internal psychological experiences is in comparison to mine.
Mhm.
I can't see both and line them up. So it's cool to see your brain map. And I'm like, oh, not everyone runs this fast. Oh, not everyone is like this. And it's, again, these are logical things that we know, but it's so helpful to see like, oh, okay, so I'm slower in this area, or it takes me longer to do these types of things. Or like for me, I run extremely fast. I run at like 15 or something. It's insane. My boss runs at like 8. So it was really helpful to know that, okay, it's, he processes very well, but he's running at half my speed, like almost half. So I'm like, okay, so that's really helpful for me to know. It's like, it's nice to be able to, in some ways, know that what's happening internally, this whole psychological conscious experience, is one way. And if I change the brain rhythms, I can actually alter that conscious experience, which I think is really powerful. And vice versa. It's more just about that interaction between the mind and the brain. And I think in neuroscience, we're really getting to, as a field, I think the field of neuroscience has been around long enough now that now we're starting to bring in those questions. I mean, I think years ago, Chalmers brought up a lot of these things about, okay, it's time we'll study consciousness. We're actually able to do the easy problem, maybe not the hard problem, but the easy problem. And I think that there's just a lot of, and with globalization, with the internet, like I just feel like and technology getting as good as it is. I mean, the fact that I can use a dry wireless headset for people to train 19, on the 1020 system, I can do that without them having to get gel in their hair every time. So they can come in, train, leave, and they got nothing in their hair. For us females, like that's huge.
Yeah.
I mean, I got people that use that dry headset almost every hour of the day sometimes. I mean, like they love it. So I just think that as technology gets better, as there's more people that are knowledgeable in this field, I just think that there's going to be, I will say the neurostimulation versus the neurofeedback's a little different. I do have a lot of people that get really freaked out because they're like, are you putting anything into my brain? And I'm like,
Right.
no, we're just reading stuff and you're doing everything. So I don't know how the neurostimulation is going to be taken in every scenario. But again, to me, it's just another tool. They're all just different tools. And I think when people start, and I think too, even our political climate, things like that, like recognizing that like our psychological well-being is really important. And, usually when you have a psychological stressors, you go to a therapist or you take medications usually, right? Or you do the other medications like alcohol and, other self-soothing type of things.
Right.
I think, not everyone, but I think a lot of people get to a place where they're like, okay, I don't love any of these options anymore, and a lot of people come to us that say, I know I could take medicine and I know I could take medications, but I know that that's not getting at the root of the problem. And I really want to get at the root of the problem. And all I can say to them is, okay, it's going to take longer than the medication would take, right? But we're actually, quote unquote, really solving the issue rather than, and it's the same thing as like putting a Band-Aid on something. Or I often give the analogy of, especially people that have far to go. It's like we're really shifting foundations, right? Like if you have a house, like we have to shift the whole foundation of it. It's going to take a while. So, as long as people accept that and really commit to it, I just see such great success. Like it's so awesome to see. It's so awesome. And I just think it's going to take more and more people doing it, spreading the word. And like I said, the technology piece is going to help because I can tell males started this field because they're like, oh, people don't mind putting paste in their hair and blah, blah, blah. And I'm like, okay. But of course, people are fine with it. But it's just, I think, like I said, I think just the more the ease of setting up, and the ease of people being, I mean, I just have dreams about, I went to New York City like a year ago and I was like, how cool would it be if people like on their lunch break could just come and like, get a little, instead of going to a gym, it's the same thing, but for your brain, so I can be really focused for the rest of the day. Which is different than what we do here. But again, that's what I mean about there's so many potentials for the different, like, how do you want to advertise it? What kind of people do you want to come in? What do you want to give to them? I think, yes, you have to build it and they will come. You have to build it and you have to explain to people, like, what's the value? So I think being able to, and again, it depends on what people come in with and what they're trying to do. Like a TBI person is going to be different than, an anxiety depression person possibly, which is going to be different than an epileptic person, which is going to be different than a peak performance intention. Like all these
Mhm.
things are different. So
Right.
yeah,
It's funny. I've had pretty much the exact same thought. I mean, it almost seems like, with, like physical therapy or something, where people come in with all these different physical ailments, that almost seems akin to kind of how we're using a lot of,
yeah.
neurofeedback or neurostimulation, to try to correct something, to try to fix something. But at the same time, like we all go to the gym, even if our arm's not hurting, we're just wanting to strengthen our muscles. Like, so I think that, to me, that philosophy is going to carry over eventually. I don't know how long, until we see that, but it's going to carry over to the brain, and people are going to realize, oh, I can do this and, you know, study for longer and get a better grade on this test, or I can, you know, focus more and do a better, report for work and end up advancing my career. I just feel like people are going to have more and more of those experiences, and it's going to become as ubiquitous as going to the gym.
And I think what's going to have to happen for it to happen is you're going to have more people have that want and awareness, but you're also going to have the technology piece so it can lower the prices. I think it's going to have to be both. You're going to have to find this entrepreneurial mindset, right? I'm trying to be in, like, how do I make this something that I even feel like I could come to and pay for, like something that I feel like is, because, it's very expensive. And people pay for it and they get better. And I love that. But there's a huge, it depends on, I hate saying it's advertising in some ways, but in some ways it's kind of like how there's so many potentials for it. So then, I mean, the only way I could think about it is you're going to have different centers that are doing different things, or people are going to come in and they're going to have different tracks, like whether it's a therapeutic track or a peak performance track or something. Like there's going to have to be some type of way that you can fit the massive umbrella of neurofeedback and make it understandable of why somebody would come there, and not just like we just said, not just for an epileptic reason or a TBI reason, but for peak performance reasons. Because yes, I might be able to study better and do all that, but if I'm paying $150, $200 a session, like, is that worth it? How often is that worth it? It's a lot of money.
Right.
For some people, I mean, money is in some ways relative, but I think most of us can agree that $200 for an hour is a lot of money.
Yeah. No, well said. Um, awesome. Well, I've really enjoyed this conversation today. Any last thoughts before we wrap it up?
Any last thoughts? Not really. The only thing I could think of is I hope that in the future, these centers and places incorporate embodiment work, like that's what to me, the restorative yoga, but the breathing, the direction of the tension work, and really just letting people allow them to have their process, rather than really trying to assume this is a linear positive path. Because I see more often than neurofeedback, it's you're getting better, but it'll be 2 steps forward, possibly 1 step back, but you're still 2 steps forward, or 1 step forward, sorry. 2 steps forward, 1 step back, you're still 1 step forward. So, really like supporting people in the fact that it takes a little while for your brain to learn these new pathways and for you to gain these different skills and these different states of consciousness. It takes a while. But it's as long as you're committed to it, like it's gonna be better. It'll be better.
Right. Agreed.
Yeah.
Awesome. Well, if you guys enjoyed the show today, go ahead and like and subscribe on YouTube, Roscoe's Wetsuit. You can also follow us on Instagram, Roscoe's Wetsuit Podcast. And you can listen to the audio versions of the podcast on Spotify, Apple Podcasts, and iHeartRadio. So go check us out. All right, Jordana, thanks so much again.
Oh, thanks for having me, man. Appreciate it.
Absolutely.